Question 1. According to federal law, which of the following forms is required for the ordering of Schedule II controlled substances? I. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer C. DEA Form 222. This question tests your knowledge of federal regulations concerning controlled substances, specifically the forms used for ordering. The keyword Schedule II controlled substances is crucial because these drugs have specific, strict ordering requirements. DEA Form 222 is the official document used by pharmacies to order Schedule II medications from distributors, ensuring a paper trail for these highly controlled drugs. For instance, if a pharmacy needs to restock oxycodone, they must use this particular form. Here's an easy way to remember it. Think of 222 as representing the two parties involved in a controlled substance transaction and the stringent control of Schedule II drugs. Question 2. A patient presents a prescription for amoxicillin. What is the primary purpose of this medication? I. To treat fungal infections. B. To reduce inflammation. C. To lower blood pressure. D. To treat bacterial infections. Answer D. To treat bacterial infections. This question assesses your understanding of common antibiotic uses, which is vital for safe and effective patient care. The drug name amoxicillin is the key clue, as it is a widely recognized penicillin-class antibiotic. Amoxicillin works by interfering with the formation of the bacterial cell wall, thereby killing the bacteria and treating infections like strep throat or ear infections. Knowing the basic purpose of frequently prescribed medications helps you correctly identify and dispense drugs, ensuring patients receive the appropriate therapy. Remember that many drugs ending in -cillin are antibiotics used to fight bacterial infections. Question 3. A prescription reads acetaminophen 325 mg per Q4-6H PRN pain. How many milligrams would a patient take in 24 hours if they took the maximum dose? I. 1,300 milligrams. B. 1,950 milligrams. C. 2,600 milligrams. D. 3,900 milligrams. Answer B. 1,950 milligrams. This question requires you to calculate a total daily dose based on given dosing instructions, a critical skill for medication safety. The keywords are maximum dose and Q4-6H, meaning every 4 to 6 hours. To find the maximum dose in 24 hours, you divide 24 hours by the shortest interval, 4 hours, which gives you 6 doses. Then multiply the single dose, 325 mg, by the maximum number of doses, 6, resulting in 1950 mg, 325 mg * 6 doses equals 1950 milligrams. Accurately calculating daily dosages helps prevent overdose and ensures patients take their medication safely. Always look for the shortest dosing interval to determine the maximum daily intake. Question 4. What is the maximum number of refills allowed for a prescription of a Schedule III controlled substance? I. 0 refills. B. 1 refill. C. 5 refills within 6 months. D. 11 refills within 12 months. Answer C. 5 refills within 6 months. This question tests your knowledge of federal regulations regarding controlled substance refills, a crucial aspect of pharmacy law. The keyword Schedule III controlled substance indicates a specific category of drugs with defined refill limitations. Federal law permits Schedule III and IV controlled substances to be refilled up to 5 times within 6 months from the date the prescription was written. For example, a prescription for Vicodin, hydrocodone/acetaminophen, a Schedule II drug prior to 2014, but Schedule III prior to that change, and a good example for a question like this if it were a different drug like Tylenol with codeine, written on January 1st, could be refilled 5 times, with the last refill being no later than July 1st. Remembering the 5 refills in 6 months rule is essential for maintaining compliance. Question 5. Which of the following is most important for maintaining the integrity of sterile compounds? I. Storing ingredients at room temperature. B. Using a laminar airflow workbench, WAF-W. C. Shaking the compound vigorously before use. D. Preparing compounds quickly. Answer B. Using a laminar airflow workbench, LAFW. This question addresses a fundamental aspect of sterile compounding and quality assurance. The keyword sterile compounds highlights the need to prevent microbial contamination, which can be life-threatening. A laminar airflow workbench, LAFW, also known as a hood, provides a controlled environment by filtering air and maintaining a unidirectional flow, thereby minimizing the risk of introducing airborne particles and microorganisms into the sterile product. For instance, when preparing an intravenous medication, using an LAFW protects the patient from potential infection. Always prioritize creating a sterile environment to ensure patient safety when compounding sterile preparations. Question 6. A patient is prescribed simvastatin. What is the primary indication for this medication? I. To treat anxiety. B. To lower cholesterol. C. To manage diabetes. D. To relieve pain. Answer B. To lower cholesterol. This question evaluates your recognition of common cardiovascular medications and their primary uses. Simvastatin is the key drug name. It belongs to the statin class of drugs. Statins work by inhibiting an enzyme called HMG-CoA reductase in the liver, which is essential for cholesterol production, thereby effectively lowering blood cholesterol levels. Patients often take simvastatin to reduce their risk of heart disease and stroke. Knowing the main purpose of frequently prescribed drugs helps you provide accurate information and ensure patient safety. Remember that drugs ending in statin are typically used to manage high cholesterol. Question 7. A pharmacy technician needs to prepare a 500 milliliters 4-bag with a concentration of 20 milliequivalent potassium chloride. If the stock solution is 2 milliequivalent/ml, how many ml of the stock solution are needed? I. 5 milliliters. B. 10 milliliters. C. 20 milliliters. D. 50 milliliters. Answer B. 10 milliliters. This question requires a basic concentration calculation, a common task in pharmacy practice. The keywords are 500 milliliters 4-bag with a concentration of 20 milliequivalent potassium chloride, and stock solution is 2 milliequivalent/ml. To find the volume needed, you need to determine the total milliequivalent required, 20 milliequivalent, and divide it by the concentration of the stock solution, 2 milliequivalent/ml, which equals 10 milliliters. This calculation ensures the correct amount of medication is added to the force solution, preventing underdosing or overdosing. Always make sure the units match when performing calculations involving concentrations. Question 8. Under federal law, what is the maximum day supply for an emergency refill of a non-controlled prescription when the prescriber cannot be reached? I. 1 day supply. B. 3 day supply. C. 7 day supply. D. 30 day supply. Answer B. 3 day supply. This question assesses your knowledge of emergency refill regulations, which are important for ensuring continuity of patient care. The keyword emergency refill of a non-controlled prescription highlights a situation where immediate access to medication is necessary, but the prescriber is unavailable. Federal regulations often permit a pharmacy to dispense a limited emergency supply, typically up to a 72-hour 3-day supply, to prevent interruptions in therapy, especially for critical medications like insulin. This allows patients to have their medication while the pharmacy attempts to contact the prescriber for a new prescription. Always prioritize patient safety by ensuring they do not miss critical doses due to unforeseen circumstances. Question 9. Which of the following is the brand name for atorvastatin? I. Zucker. B. Lipitor. C. Crestor. D. Pravachol. Answer B. Lipitor. This question tests your knowledge of common brand and generic drug names, which is crucial for accurate dispensing and patient communication. The generic name atorvastatin is the key. While all options are statin medications, Lipitor is the well-known brand name for atorvastatin. Knowing both brand and generic names helps prevent medication errors and ensures you can correctly identify prescribed drugs, regardless of how they are written. A useful tip is to create flashcards for common brand/generic pairs to help with memorization. Question 10. When a medication is recalled by the manufacturer due to a potential health hazard, which class of recall is generally issued for the most serious situations where there is a reasonable probability of serious adverse health consequences or death? I. Class 1. B. Class 2. C. Class 3. D. Market withdrawal. Answer: I. Class 1. This question focuses on medication recall classifications, which is essential for patient safety and quality assurance. The keywords potential health hazard, most serious situations, and serious adverse health consequences or death all point to the highest level of risk. A Class 1 recall is issued when there is a reasonable probability that using or being exposed to a violative product will cause serious adverse health consequences or death. For example, if a medication is found to contain a dangerous contaminant, it would likely be a Class 1 recall. Always prioritize quickly identifying and removing Class 1 recalled products to protect patients from severe harm. Question 11. A patient is prescribed 10 milliliters of a liquid medication to be taken twice daily. How many days will a 240 milliliters bottle last? I. 6 days. B. 12 days. C. 24 days. D. 48 days. Answer: B. 12 days. This question requires calculating the day's supply of a liquid medication, a practical skill for patient counseling and inventory management. The keywords are 10 milliliters twice daily and 240 milliliters bottle. First, calculate the total daily dose. 10 milliliters * 2 doses/day equals 20 milliliters per day. Then, divide the total volume in the bottle by the daily dose. 240 milliliters/20 milliliters per day equals 12 days. This calculation ensures that patients receive an appropriate quantity of medication and that their refills are timed correctly. Always make sure to consider the total daily consumption when determining how long a supply will last. Question 12. Which of the following is a common side effect of opioid pain relievers? I. Diarrhea. B. Constipation. C. Insomnia. D. Hypertension. Answer: B. Constipation. This question tests your knowledge of common drug side effects, which is crucial for patient counseling and monitoring. The keyword opioid pain relievers indicates a class of drugs known for specific adverse effects. Opioids frequently cause constipation because they slow down the movement of the gastrointestinal tract. Patients taking medications like oxycodone or hydrocodone often need to be counseled on strategies to manage this side effect, such as increasing fiber intake or using stool softeners. Being aware of common side effects helps you educate patients and ensure their comfort and safety. Question 13. The Food and Drug Administration (FDA) is responsible for which of the following? I. Setting prescription prices. B. Licensing pharmacists. C. Approving new drugs for market. D. Regulating insurance companies. Answer: C. Approving new drugs for market. This question assesses your understanding of the FDA's role in drug regulation, a key component of pharmaceutical law. The FDA's primary responsibility related to medications is ensuring their safety and efficacy before they can be sold to the public. They review clinical trial data and manufacturing processes before granting approval for new drugs to enter the market. For instance, before a new cancer drug can be prescribed, it must undergo rigorous testing and receive FDA approval. Understanding the FDA's role ensures you appreciate the standards medications must meet before they reach patients. Question 14. What is the best practice for preventing look-alike/sound-alike, lossy, medication errors in a pharmacy? I. Storing all medications alphabetically. B. Placing loss of medications in different locations or using warning labels. C. Only using generic names for dispensing. D. Ordering all medications from the same supplier. Answer: B. Placing loss of medications in different locations or using warning labels. This question focuses on strategies for preventing medication errors, a critical aspect of quality assurance in pharmacy. The keywords lookalike/soundalike, lossy, medication errors highlight a common cause of dispensing mistakes. To prevent confusion between drugs like clonidine and Klonopin, pharmacies should separate them on shelves or use auxiliary labels and distinctive bins. Implementing these safeguards reduces the chance of selecting the wrong drug, thereby protecting patient safety. Always be vigilant for loss of drugs and use systems to minimize the risk of errors. Question 15. What is the appropriate storage condition for most refrigerated medications, unless otherwise specified? I. 0 degrees Celsius to 2 degrees Celsius, 32 degree F to 36 degrees Fahrenheit. B. 2 degrees Celsius to 8 degrees Celsius, 36 degree F to 46 degrees Fahrenheit. C. 8 degrees Celsius to 15 degrees Celsius, 46 degree F to 59 degrees Fahrenheit. D. 15 degrees Celsius to 25 degrees Celsius, 59 degree F to 77 degrees Fahrenheit. Answer B. 2 degrees Celsius to 8 degrees Celsius, 36 degree F to 46 degrees Fahrenheit. This question tests your knowledge of proper medication storage, which is vital for maintaining drug efficacy and safety. The term refrigerated medications is the key indicator for a specific temperature range. Most medications requiring refrigeration should be stored between 2 degrees Celsius and 8 degrees Celsius, 36 degree F and 46 degrees Fahrenheit to prevent degradation while avoiding freezing. For example, insulin vials are typically stored in this temperature range to maintain their potency. Correctly storing medications ensures that they remain effective for patients and prevents wastage. Question 16. A nurse calls to ask for the infusion rate for an 4 bag containing 1,000 milliliters of normal saline to be infused over 8 hours. What is the flow rate in ml/hr? I. 80 milliliters per hour. B. 125 milliliters per hour. C. 150 milliliters per hour. D. 200 milliliters per hour. Answer B. 125 milliliters per hour. This question requires a simple calculation of 4 infusion rate, a common task in hospital or compounding pharmacy settings. The keywords are 1,000 milliliters and over 8 hours. To find the flow rate in ml/hr, you simply divide the total volume by the total infusion time. 1,000 milliliters/8 hours equals 125 milliliters per hour. This calculation ensures that the medication is delivered to the patient at the correct speed, which is crucial for therapeutic effect and patient safety. Always double-check your calculations for 4 infusion rates to prevent errors. Question 17. The abbreviation NPO on a patient's chart means I. Take by mouth. B. Nothing by mouth. C. As needed. D. At bedtime. Answer B. Nothing by mouth. This question tests your knowledge of common medical abbreviations, which is essential for accurately interpreting prescription orders and patient instructions. The abbreviation NPO is a widely recognized medical shorthand. It stands for the Latin phrase nil per os, meaning nothing by mouth. This instruction is often given before surgery or certain medical procedures to prevent aspiration or interference with diagnostic tests. Understanding this abbreviation ensures patient safety and compliance with medical directives. Question 18. Which of the following drugs is therapeutically equivalent to amlodipine? I. Lisinopril. B. Nifedipine. C. Verapamil. D. Valsartan. Answer B. Nifedipine. This question assesses your understanding of therapeutic equivalence, focusing on drugs within the same class that achieve similar clinical effects. The key is amlodipine, which is a dihydropyridine calcium channel blocker used for hypertension. Nifedipine is also a dihydropyridine calcium channel blocker and is therefore therapeutically equivalent in terms of its mechanism of action and primary use, although dosages and specific patient responses may vary. While other options like verapamil are also calcium channel blockers, they are of a different subclass, non-dihydropyridine. Recognizing therapeutically equivalent drugs helps you understand substitution options and drug interactions. Question 19. What is the primary purpose of a medication error reporting system in a pharmacy? A. To punish staff for mistakes. B. To identify patterns of errors and implement preventive measures. C. To track patient complaints. D. To determine staff performance bonuses. Answer B. To identify patterns of errors and implement preventive measures. This question focuses on the core function of medication error reporting systems, which are crucial for quality assurance and patient safety. The primary goal of such a system is not punitive but rather to learn from mistakes. By collecting data on medication errors, pharmacies can analyze trends, identify root causes, and develop strategies to prevent similar errors from happening again, thereby continuously improving the safety of medication dispensing. For example, if multiple errors involve similar-looking drug names, the system helps identify the need for separate storage or warning labels. Always remember that error reporting is about improvement, not blame. Question 20. A pharmacist needs to prepare 100 milliliters of a 2% hydrocortisone cream using hydrocortisone powder and a plain cream base. How many grams of hydrocortisone powder are needed? A. 0, 2 grams. B. 2 grams. C. 20 grams. D. 200 grams. Answer B. 2 grams. This question involves a basic percentage calculation for compounding, a common math skill for pharmacy technicians. The keywords are 100 milliliters and 2% hydrocortisone cream. A 2% concentration means there are 2 grams of active ingredient in every 100 grams, or ml for creams, assuming a density close to 1g/ml of the final product. Therefore, for 100 milliliters of a 2% cream, 2 grams of hydrocortisone powder are needed. Accurately calculating the amount of active ingredient is essential for preparing compounded medications correctly and ensuring patient safety. Question 21. What does the acronym REMS stand for in the context of drug safety? A. Randomized Efficacy Management System. B. Risk Evaluation and Mitigation Strategy. C. Regulatory Enforcement Monitoring Schedule. D. Research, Education, and Medication Support. Answer B. Risk Evaluation and Mitigation Strategy. This question tests your knowledge of important drug safety programs mandated by the FDA. The acronym REMS is crucial for understanding how certain drugs with significant risks are managed. A Risk Evaluation and Mitigation Strategy, REMS, is a program required by the FDA for certain medications with serious safety concerns to ensure that the benefits of the drug outweigh its risks. These strategies often involve special training for prescribers, patient education, or restricted distribution. For example, isotretinoin, used for severe acne, has a comprehensive REMS program due to its teratogenic effects. Question 22. A patient with a severe penicillin allergy should generally avoid which of the following antibiotics due to potential cross-reactivity? A. Azithromycin. B. Cephalexin. C. Doxycycline. D. Ciprofloxacin. Answer B. Cephalexin. This question assesses your understanding of drug allergies and cross-reactivity, which is vital for patient safety. The key phrases are severe penicillin allergy and cross-reactivity. Cephalexin, a cephalosporin antibiotic, has a structural similarity to penicillin, meaning there's a risk of allergic reaction in individuals allergic to penicillin. While the risk is not 100%, it's important to exercise caution, especially with a severe allergy. Always carefully screen for drug allergies and potential cross-reactivities before dispensing any medication. Question 23. A patient is allergic to sulfa drugs. Which of the following medications should they avoid? A. Metronidazole. B. Amoxicillin. C. Sulfamethoxazole trimethoprim. D. Azithromycin. Answer C. Sulfamethoxazole trimethoprim. This question tests your knowledge of drug allergies and specific drug classes, which is crucial for preventing adverse reactions. The keyword sulfa drugs immediately points to medications containing a sulfonamide component. Sulfamethoxazole trimethoprim commonly known as Bactrim or Septra, is a combination antibiotic that contains a sulfa drug and should therefore be avoided by patients with a sulfa allergy. Administering this medication to an allergic patient could result in a severe, life-threatening reaction. Always carefully screen for reported allergies and be aware of drugs that belong to known allergenic classes. Question 24. What is the primary reason for frequently washing hands in a pharmacy setting? A. To keep hands clean and tidy. B. To prevent the spread of infection. C. To remove medication residues. D. To meet aesthetic standards. Answer B. To prevent the spread of infection. This question emphasizes the fundamental importance of hygiene in preventing disease transmission, a core principle of quality assurance and infection control. The primary reason for frequent hand washing in any healthcare setting, including a pharmacy, is to remove transient microorganisms and thereby prevent the spread of infectious agents to patients, staff, and medications. For example, washing hands before and after handling prescriptions or compounding ensures that harmful bacteria or viruses are not transferred. Always remember that proper hand hygiene is the simplest and most effective way to protect everyone from infection. Question 25. Which of the following medications is available over the counter? OTC. A. Lisinopril. B. Metformin. C. Ibuprofen. D. Alprazolam. Answer C. Ibuprofen. This question tests your knowledge of the difference between prescription-only (RX) and over-the-counter (OTS) medications. Ibuprofen is the key. While it can be prescribed in higher doses, lower doses are widely available without a prescription for pain and fever relief. The other options listed are prescription-only medications. Knowing which medications are OTC helps you guide patients to appropriate self-care options and distinguish between RX and OTC products when processing prescriptions. Question 26. Which entity is responsible for licensing and regulating pharmacists and pharmacy technicians within a specific state? A. Centers for Disease Control and Prevention, CDC. B. Food and Drug Administration, FDA. C. State Board of Pharmacy. D. Drug Enforcement Administration. D. Answer C. State Board of Pharmacy. This question focuses on the regulatory bodies governing pharmacy professionals at the state level. The keywords licensing and regulating pharmacists and pharmacy technicians within a specific state are the direct indicators. The State Board of Pharmacy is the primary authority in each state responsible for setting standards, issuing licenses, conducting inspections, and enforcing state pharmacy laws. For instance, if a pharmacy technician needs to renew their license, they would interact with their State Board of Pharmacy. Understanding the role of the State Board is crucial for ensuring compliance with state-specific regulations. Question 27. N4 infusion is ordered to run at 75 milliliters per hour. If the drop factor is 15 drops/ml, how many drops per minute should be administered? A. 15 drops/min. B. 19 drops/min. C. 75 drops/min. D. 1125 drops/min. Answer B. 19 drops/min. This question requires calculating N4 drip rate, a common calculation for pharmacy technicians involved in sterile compounding or medication preparation. The keywords are 75 milliliters per hour and 15 drops/ml. First, convert ml/hr to ml/min by dividing by 60 minutes. 75 milliliters per hour/60 minutes per hour equals 125 ml/min. Then multiply this by the drop factor. 125 ml/min * 15 drops/ml equals 18, 75 drops/min, which rounds to 19 drops/min. Accurate drip rate calculations are essential for ensuring medications are delivered at the intended speed, impacting patient safety and therapeutic outcomes. Question 28. To minimize the risk of dispensing errors, which two drugs should be carefully separated on the pharmacy shelf due to their look-alike/sound-alike nature? A. Amoxicillin and azithromycin. B. Warfarin and glipizide. C. Celebrex and Celexa. D. Metoprolol and lisinopril. Answer C. Celebrex and Celexa. This question highlights the importance of recognizing lookalike/soundalike, lossy medications to prevent errors, a key aspect of patient safety. Celebrex and Celexa are the critical drug names here, as they sound very similar and their packaging can sometimes appear alike, leading to potential confusion. While other pairs might have similar characteristics, this specific pair is frequently cited as a high-alert LASA risk. Physically separating LASA drugs or using warning labels is a crucial strategy to prevent medication errors. Always be extra cautious when handling drugs that sound or look similar to avoid dangerous mix-ups. Question 29. A pharmacy implements a new barcoding system for all medications at the dispensing stage. What quality assurance goal does this primarily address? I. Reducing medication costs. B. Improving inventory management. C. Preventing dispensing errors. D. Increasing prescription volume. Answer C. Preventing dispensing errors. This question focuses on the benefit of technology and quality assurance within a pharmacy setting. The implementation of a new barcoding system for all medications at the dispensing stage directly addresses the critical need to verify that the correct drug, dose, and form are being dispensed to the patient. Barcode scanning helps ensure that the medication being picked matches the medication prescribed, significantly reducing the risk of wrong drug errors. This system acts as a final safety check before the medication reaches the patient. Using technology like barcoding is a powerful tool to enhance patient safety and minimize errors. Question 30. Which of the following pieces of information is not legally required on a prescription label for a dispensed medication? I. Patient's name. B. Pharmacy name and address. C. Prescriber's DEA number. D. Drug name and strength. Answer C. Prescriber's DEA number. This question tests your knowledge of essential information required on a dispensed prescription label, which is critical for patient safety and legal compliance. While a prescriber's DEA number is required on the prescription order for controlled substances, it is generally not legally required to be printed on the patient's dispense label itself. The label must include details like the patient's name, pharmacy information, drug name/strength, directions, and the prescription number. Knowing what information is essential on the label helps ensure all legal and safety requirements are met.